Is now starting. All attendees are in listen-only mode.
This is Dr. Richard Barwell, and welcome to Neurologically Based Chiropractic Webinars. This one is on NBC Care Guidelines, which has always been a biggest challenge when it comes to practices. What kind of care plans do I lay out for people? It was a challenge from day one when we were at chiropractic college because of the reason that we didn't have proper guidelines to begin with. We only had two things that we had to consider for care, and one of them was it was duration and frequency of the care, and the care ended once the signs and symptoms were gone. It was that simple. However, that doesn't work out when we talk about the real reasons for people having problems. We need to look at this from a different aspect. So I just wanted to bring you into what's going on with some concepts, and here's where we are. You know, have you ever been challenged with setting up a patient care plan? I know that in my practice it was always a challenge, and then we ended up following some care plans that were laid out by Jim Parker, and that was that care plan to build the maintenance practice, which was 3 times a week for 2 weeks, twice a week for 2 weeks, once a week for 2 weeks, and then once a month for the rest of their life. And the idea of that was to build an income-based practice where you had people coming back for care. And while the object was, let's get people under care for a lifetime at once a month, it was never based on anything that met any kind of criteria for patients' needs or to be supported by any kind of examination. So while it worked, it just wasn't the best way to do this. And it was a challenge when we said, well, gee, for a patient's pains are gone or complaints are gone, how do we even judge what to do then? And what happens is the people leave when the pain is gone or the challenge is gone, and now we have to replace them. And that has led to this concept of we need to keep getting new patients in chiropractic. We need to focus on new patients and new patient programs. And that's so defeating and so frustrating because we end up feeling like we're just super salesmen all the time. So what criteria do you use for a care plan in your office? I mean, that's something we need to consider, and this is based on what's the intent of the care in your office. Does your care plan address the neurological needs of each patient? That's a major question. You know, what is the intent of your care? To relieve pain, then when pain's gone, they're gone. Or is it something higher than that? Is it to improve the function of the individual? Well, how do we do that? How do we measure that? Do you use symptom relief as a sign of success of care? And that's the problem with 90%, if not more, of this profession. We all use that. That's all we had to go on. We were taught that at school. And the problem with that is if that's successful, then you're just in that treadmill all the time. And we know that we do a good job of getting rid of signs and symptoms, but that's not the real issue that we need to be looking at with chiropractic. So does every patient get the same care plan? Is it all just, I need to see you 3 times a week for 12 weeks, period? Everybody gets the same thing. Or is it even worse than that? Well, let's see how you're going this time, Mrs. Jones, and we'll check you on Wednesday and see how you're going on Wednesday, and then on Wednesday, well, we'll check and we'll see how you're doing on Friday, and so it's visit by visit. I mean, that's just so frustrating. So here's the problem. So here's the problem. If you're doing the same thing over and over and over again, you're going to get the same results. And if you want to change and really build something different in your practice, you've got to start addressing what's going on in your office. You've got to look at what the cause is of your practice being stalled, or your practice not fulfilling your dreams, or just that your practice is plateaued. You may have a great practice, but it may be plateaued and there's nothing you can do about it. What do we need to do to change that? How do we change the concept of chiropractic in the minds of the patient? The focus of care for each patient should be to make each adjustment the most effective as possible with that patient. And that's a critical issue. It's not just, pounding down the high spots, but it's adapting that care for those patients' needs. And we've all gone through this, those of us that have been in practice any length of time, we've all gone through this, having two people present with the same type of problem. I don't care if it's a right sciatica with the same history that's been going on for years. It's the same pattern. It's worse when they're sitting down, or it's worse when they're standing, or whatever. And we adjust these people the same way, and we find out that one of them gets better and the other one doesn't. And we need to understand why that's happening. The reason for the adjustment gets result is due to its powerful effect on the central nervous system. It has nothing to do with this concept of taking nerve root pressure off by moving a bone. There's something that's so much greater that's going on with this, and we know this now. The research shows this now, that the adjustment directly affects the central nervous system, which allows it to reset itself, and therefore it changes the neurological pattern, it changes the muscle pattern, and it changes then whatever that muscle is doing, whether it's moving a vertebrae or whether it's making the gut work or the heart run or you breathe. But that's the thing that is the difference now, that we don't have to fall back on this concept of the old water hose when pressure on the nerve. That has never been proven, and we all know that that's the biggest challenge we're having right now in the profession with this split that's going on, that's saying you've got to deny that vertebral subluxation exists. Well, I hate to tell them this, but it does exist, but it just doesn't exist as a primary. It's a symptom, not a cause. So when you throw out the baby with the bathwater, you end up in trouble. We know this too. We know all techniques work, but they're even much more effective when they match the needs of the patient. And we find that we usually have 3 or 4 different techniques approach, and if one's not working, we go like, oh, what the heck, I'll try this other one, and all of a sudden we get a result. So then we start using that one for several patients until we get a patient that it doesn't work with. Then we go like, well, maybe I'll go back and just adjust the atlas, and we find that that works for that patient. That's because we need to be able to determine what care is best for them. The patient's needs change as their system responds to care. So doing the same thing with that same patient over and over again isn't in the best interest of the patient. Because as that patient's nervous system is improving, you need to change what you're doing to make sure that it aligns with their neurological needs. It's sort of like going to a dentist and having a dentist refilling the same tooth all the time. You wouldn't stand for that. So what they do is they fix the problems, and then they start maintaining it, and they just end up doing cleaning if you've got good dental health going on. It's changed the needs with the needs of the patient. The goal of care is to improve the patient's neurological function. That is the goal of chiropractic care from day one. That's our goal, to improve the patient's neurological function. So we need to look at this. What's NBC, neurologically based care profiles? What's this look like? Well, the first thing that we need to do is we have to hear the patient's complaint as a new patient. It doesn't mean you ignore them. It means you hear what they have to say, because they're all trained, not only chiropractically, but medically, to wait until they have signs and symptoms or some sort of problem and then come in for care. And the goal then that we have is to move the patient from signs and symptoms-based care to cause-based care. And it's so simple to do. It really is. The doctors get hung up on this all the time. And try this. Just try asking this right off the bat. When you listen to what their complaint is and you've got it all down, you know that they had low back pain on the right side. It went down the leg to the knee. It started 2 weeks ago. They've had it before. They were lifting a heavy box, and they think that's what caused it. Their back went out, and they've been taking some aspirin with it. They've been to chiropractors. They've had pretty good results with it. You go like, great. I want to tell you that research shows that chiropractic does a good job with this type of problem, and so you're in the right office. Let me ask you a question. Would you like care that only deals with your symptoms and leaves the cause, or would you like care that addresses the cause of your challenges? This is your choice. And this may sound like one of those dumb leading questions. It is. It is a dumb question because you're dealing with dumb people. And I don't mean that as an insult. I mean that they're dumb because they don't know. They haven't had the information to make the right decisions. So you have to give them some questions that lead them into making a different decision. And that's why that is such a powerful question to ask. The majority of them are going to say, I want care that deals with the cause of my problem. Say, great, that's what we do in this office. It's a little different than probably what you've experienced in the past because we operate on new information. So there's different types of care. There's initial crisis care. That's the care to try to get somebody who is in such antalgic or acute responses that you're trying to get them just settled down. You know, if someone's in so much pain, they're not going to make very good decisions. Their cognitive functions aren't good, and you can just try to get them settled down, and it may involve just using some alternating hot and cold to get them out of that acute pain situation. The primary care that we would like to really have people looking at is what we call initial stabilization care. And that's the care where it goes past signs and symptoms relief. We'll talk about this in a moment. Then there's the last one called peak performance care. So let's look at the first one, initial crisis care. The presenting complaint needs to be heard. You need to acknowledge that they have this challenge. And what we're going to do is we're going to talk about trying to get those symptoms that they've come in with at least settled down. Stabilization care is different. It's cause-based care. This is where we start to enter into a new field of chiropractic. This is care beyond symptom relief and is focused on improved neurological function. The last one, the peak performance care, this is wellness care updated. Wellness care didn't mean much. The term doesn't mean much. We're not really even sure what wellness is, because if it's only the absence of signs and symptoms, that doesn't mean that they don't have problems going on. It just haven't reached the signs and symptoms level. So it's got to be something greater than that. And there is a way of updating that. Acute care or initial crisis care, the majority of new patients are going to fall into that because that's what we train them. The goal is to offer them relief at that moment plus something of greater value. Yes, we can help you. As a matter of fact, we can not only help you get rid of your signs and symptoms, but we can help you get this stabilized to reduce the incidence of this in the future. Patients need information to support a new direction in health thinking. This is the shift, and this is a shift that has to happen in that patient's mind, but first of all, it's got to happen in the doctor's mind. It has to be your office that shifts its concepts about what it is that you have to offer. Informed consent is the key to higher patient visit average practices. And everybody needs to have a high patient visit average practice. I can tell you that it is a joy, and it's what I thought chiropractic was supposed to be about. My PVA was in the 150 range, and it was just amazing, and it was all based on informed consent. It was giving people information that they could make a decision, an informed consent, with information that they'd never heard before. They didn't understand that chiropractic dealt with the cause of their problem. They didn't understand that there was even that opportunity. So when we finally explained it to them, they chose to go to that next level of care. And informed consent creates compliance. When you get a patient to agree on their terms, that they agree that they want to have this type of care, the compliance level goes sky high. My compliance level was well over 90% with my patients. Initial stabilization care, cause-based care, this is where you would present the 3 systems of the body and then ask the patient which care they would be which approach would be best for them. We'll show you what that 3 systems of the body are in just a moment. But this is how they get to make decisions that are based on new information. Not everybody will want this. Some will only want symptom relief. You have a choice of whether you want to take those patients on and deal with them with symptom relief only or not. You'll get to a point in your practice when you build a wellness or a stabilization-based, neurologically based chiropractic care practice that you probably won't want to deal with these people and will end up referring them out because all they want is pain relief, and you know that they're not going to keep their last few appointments because the minute they get feeling better, they disappear, and you spend the rest of the day having your staff chase them all over town. It's a time wasting, it's an energy wasting. These people are just frustrating to deal with. You can take them in, but you have to have some agreement to take them in. You can offer this level of care without any expectation of them remaining under care once the symptoms are gone. They're going to just disappear. Do not think that they're going to sign up for lifetime wellness care because you're the one that's going to be frustrated. If you get this cleaned up with the patient, between you and the patient, you have an alignment of intent of care, and that's the kind of things that reduces the stress in the practice. peak performance care, wellness care updated, and what this does is once we get them past their signs and symptoms relief and into stabilization care, where we can actually measure that we are improving their neurological function, and they complete that first series of care, whichever length of time it may be, you do your post-examination, you can show them what's going on, but by the same token, you can show them what areas of their nervous system are not in balance, and so this now becomes peak performance. Those couple of areas or 3 areas where the nervous system is still not functioning right, that's our goal now. We're going to focus on that. We're going to put you on special adjusting and training programs to try to get those areas back into balance as well, to make you as ideal as we possibly can neurologically. That's now available. It was never available before. This is something that's a whole new concept, and now we have objective outcome studies to show this, to prove with the examination. This level of care is for patients who have moved beyond stabilization care. Symptoms would have been reduced or eliminated early on. They're already done. So we're not dealing with the patient that says, gee, doc, I'm feeling better, I have to come back. Because what they know already and what they agreed to already, they knew that the symptoms are going to disappear. Their goal is to get that base goal line that we set to have their nervous system working better, and we need to be able to show them that we're getting that. Neurological patterns will start to show improvement. The focus shifts to the patterns that are still challenged, and now we start striving for ideal neurological responses. So here's where chiropractors stumble. They have a tough time right at this point. And the point is this: shifting the patient from their symptom base to cause base. And the reason they have a problem is because the doctors are stuck in the symptom-based chiropractic. We have to find the bumps and pound them down. The cause of your problem is vertebral subluxation, and if we correct the vertebral subluxation, our job is done. Not true. The vertebral subluxation is there as a symptom. It says that the nervous system is not working correctly. Even if you correct those, that central nervous system pattern needs to be fixed. And so doctors, you need to think about what this is all about. This is the critical paradigm shift that has to happen in your head before it's going to happen in your staff's head, and especially in what you offer your patients. This is the key. I have to tell you that all that stuff you learned when you were at chiropractic college, you need to forget. You need to move on to what's now been revealed by the latest research and studies. It's just incredible. I just got a paper today where they said that there's been a big discovery that there are brain tissues that communicate directly with the immune system. This is big news. This is huge. It's published in Nature. I mean, we've been talking about this for 100 years. But you see, because our education pulled us backwards into that medical model, we forgot about what it was that we had to offer, that we deal in a whole different ballgame. So here's the question of these 3 primary systems of the body. And when you ask patients this, it's like the light bulb goes on. You can say, well, here's the 3 systems of the body. First, we have the bones and joints. And that's really interesting, and that's where chiropractic has been focused for a long time. But I need to tell you this. We've discovered that the bones and joints do nothing on their own. They're passive. This is called the passive system. So if it's passive, it can't be the cause of your problem. Something else must be going on. The second part is the muscles. And the muscles, we know, move all the bones and the joints, but it's bigger than that. They create every single action in your body, from your blood flowing through your arteries and your veins, your breathing, your elimination. Everything that goes on in the body has to have muscle activity. But you know what? Even though that's the active system that drives the passive system, it does nothing on its own, so it can't be the cause of your problem either. So going and getting a massage may make you feel good, but it's still not dealing with the real problem. And here's what we know today. The nervous system controls the muscles that control the bones and joints and all the other activities. And that's where the problem lies. Something's going wrong within that central nervous system, your great computer that controls everything that goes on in your body, that isn't allowing it to function ideally. We need to find out what's going on within your nervous system, how it's imbalanced, and how that's creating your problems. Which system do you think would be best for us to be looking at? And you ask them that question. And they're going to go, well, I guess the nervous system. Exactly, that's all we do in this office is we work directly with improving the function of your central nervous system. You just elevated yourself from a bone doctor and a back doctor and a pain relief doctor to a functional neurologist position. You tell me which you think has more value in the mind of the patient. And I wish it would have more value in the mind of the doctor, because that's what you truly are. You have so much more to offer than taking care of back problems or neck problems. So what happens? Well, we have a balanced nervous system, or we can have an increased tone or a decreased tone in the nervous system. Or we can have a system that is going back and forth between increased over-aroused system or a decreased under-aroused system. And that's called a bipolar shift. Or if it gets really bad, you can end up down in the exhausted nervous system, and that is a life-threatening situation. So we took this information and we put it into a chart called the biochart. And this was what we suggest you use in the office. We found this to be one of the best new patient systems that we've ever found. So if you have a balanced nervous system, you have high energy, infused symptoms, excellent health, you're active, you're vibrant, you've got positive mental attitude, everything's going great. If that starts to get unbalanced, we start to see some patterns show up. Like, for instance, if you have an over-aroused nervous system, you can have cold hands or cold feet and tight muscles, or maybe grinding your teeth, or have irritable bowel syndrome, or high blood pressure, or high heart rate. That's all a sign of an over-aroused system. Or you can have a system that's starting to shut down because it can't handle it. So what happens is it goes into that under-aroused state. And this is poor concentration, constipation, low energy, you're always sleepy, you're easily distracted. There's all sorts of problems that go on with an under-aroused system. I can tell you right now that the majority of people, probably into that 90% ratio, fit into the over-aroused system. The unstable system, you may have signs and symptoms in any of these areas, over-aroused or under-aroused, but you're going to start showing some problems in the unstable area. In the unstable area, you're going to get some problems with like cold hands, but you may have migraines or seizures, or you have PMS or eating disorders or mood swings, bipolar disorders. That means your system is going from one side to the other, and it's a crash course. And boy, I'll tell you what, if you're dealing with somebody that's over-aroused and you give them a stimulating adjustment, you're going to make their matters worse. Down at the bottom, we have exhausted nervous system. And what you'll see down there is every system that falls into that is an autoimmune system disorder. The immune system has now given up on the nervous system supplying information, and it goes into crash mode, and it starts to just eat on itself. This is life-threatening. All of these are life-threatening. They're telling you that this system is failing. And so you have to take a look at what's going on here. Now, somebody with over-aroused versus somebody with under-aroused, the type of care should look different. Somebody that's unstable, their care shift may happen each visit as their nervous system changes. And the exhausted nervous system, that takes something that's very special with care to help them get back. So you need to know these kind of things. Biochart, that's what we call it. So you get the patient to identify their health challenge is neurological in nature. And they put this down, and the question when they hand that back to you, and they've got all the check marks off in the high and the over-aroused, and you can ask them right then. You say, well, here's what I'm going to ask you again. You think the best care that we could offer you would be just to get rid of your signs and symptoms, or would it be to get your nervous system back in balance that's causing you to have those signs and symptoms? And they're going to say, get my nervous system back in balance. And once again, you can reinforce the fact that that's what you do in your office. Okay? What system is the primary focus of chiropractic care? Chiropractors have forgotten this. They know it, they tell me it, but they don't practice it. And it's the nervous system. That's the primary focus of chiropractic care. It's always been to affect the nervous system. So if that's the case, and in your mind you know this, my question next is this: is your examination congruent with this intent of your care? Or are you doing orthopedic tests and joint studies to see what's going on with the joints? Because if you're doing that, that's not looking at the nervous system, that's looking at a structural challenge, not a neurological challenge. And now our incongruencies start to show up, and it shows up in the mind of the patients as well. It's just like when you're talking about chiropractic and the nervous system and you hold up the vertebra in front of the patient, you become a back doctor or a bone doctor. How can we examine the nervous system or neurological function and then set our care plan to improve that function? If that's our goal, we need to be examining the nervous system, and we need to set our care plans to show that that's how we're measuring the improvement. You have to be able to do that. That's been our problem. We haven't been able to do that until now, and now we can. You know, you can get a functional MRI or a PET scan in your office, but it's not practical because I doubt you have a couple $1 million lying around to put it in there, and then to irradiate patients like that just isn't a practical idea. There has to be a better way of doing it. X-ray does not provide neurological information. X-ray is a great history lesson as to what's happened to that patient over time and what stages of degeneration they're in because of improper neurological function. Static paraspinal SEMGs or thermal scans do not directly address the central nervous system. And besides that, they're just a moment in time. They're static. And so they only give you the picture of a moment in time just like an X-ray does. So there's got to be a better system. Doing static paraspinals and thermal scans was better than just doing an X-ray, but it was just a door opener to where we had to go. Autonomic nervous system challenges show limbic system responses. So the autonomic nervous system, and we know that chiropractic affects the autonomic nervous system. There's been lots of studies done on that. And what it's actually showing is that's part of the brain that's responding, called the limbic system, where your autonomic nervous system lives. That's your sympathetic, parasympathetic balance. And so we can use those. We can even go higher than that. We can go up to EEG, cortical patterns that drive the limbic system. Now we're looking at the hard wiring of the brain that really is the driving force that controls what's going on at the limbic system. And today we can look at those things, and we can look at them from a chiropractic standpoint. Your examination. Congruency is important. It's not just important, it's absolutely critical. If you set up the nervous system as the focus of care and don't gather neurological information, there's a gap in your congruency. And like I said here, it's more than a gap, it's a Grand Canyon. Because the patients are well aware. They listen to our wonderful talk about chiropractic and the nervous system, and then we shift them away from that, and they lose that great understanding about chiropractic. What can you do to have a neurological exam that applies to your practice? Well, let's start with the autonomic nervous system. These are how you measure sympathetic, parasympathetic balances. You look at heart rate, you look at blood pressure, extremity temperature, muscle tension, skin conductance, heart rate variability, respiration rates. All of those are autonomic function, are the autonomic nervous system functions you can directly use to measure what's happening with them. We know what the ideals are, and we can measure what's going on with these people against ideals. What's even better is if we can stress these people in different ways and let them try to recover, we can see whether or not they respond in these areas, ideally to stress, and whether or not they recover, which is the biggest part of the problem. People are not recovering. We can also look at cortical brain patterns and see what kind of brainwave states these people get stuck in, what kind of patterns are going on in there that is the primary cause of their problem in the first place. We need to look at the stress levels in their life. So the history needs to be involving what's going on in stressors in your life over what period of time. There are intake forms to be able to use for this, and they really, really can help you to understand what's going on with that patient. Balance and posture are critical as well. Those are things that are the picture of your neurological interference. If your posture is bad or if your balance is off, that tells you you've got big challenges that have gone on within that central nervous system over time that's now creating havoc. You can do this with an instrument called the NeuroInfiniti. I designed this for chiropractic use to fill this gap that we didn't have. It's been around now for 15 years. This thing is, it's in its about 4th or 5th state of development. It's been tested, it's been used around the world. It gives you accurate, extremely accurate research quality material that you can depend on. And it's a computerized test. It takes about 15 minutes in a dynamic computerized test to do it. This little guy here is hooked up. You can see the EEG on his head, so we're measuring the cortical activity going on, and now down on the hands and the waist, we're measuring all those other functions at the autonomic nervous system level all at the same time. So we can actually see what's going on. That's what the unit looks like on the left-hand side. And it's there, it's designed for chiropractic office to answer the question we were never able to answer. So what are you looking for? Well, as simple as this. Heart rate. You're looking for ideal or above ideals, where it's too much, the heart rate is too high, or it may be too low. And if you have a low heart rate, you've got something going on with this individual. They're either a runner, a bicycle rider, a swimmer, or they're on meds. And the interesting thing about heart rate, you know, you have all these athletic people who think that having a low heart rate is the ideal. And so they work themselves cardiovascularly like crazy to get their heart rate way down. Do you know that the average lifespan of a marathoner is 55 years? 55 years. Because there's another part of heart health that we've got to look at outside of heart rate. So just because they have a low heart rate doesn't mean they're healthy. You may have poor variation where it doesn't move at all, it doesn't adapt to stressors or recover from a stressor. You may have chaotic responses where when you rest, your heart rate goes up, and when you relax, your heart rate goes down. Those are all signs of heart health that we need to be looking at if we are truly dealing with health of our patients. Extremity temperatures. Hand temperatures drop during stress. It's the fight-flight response. So right off the bat, we need to know, are they below ideals? Are their hand temperatures cold? And we find a lot of people would say, well, they're always cold. It's normal for me. No, it's not. That just tells you that nervous system is not adapting and functioning properly. That's a sign of neurological stress. They may be too high. And again, that's an acute response. That thing is really into fight-flight. It may be chaotic. It may go the wrong way. It should go, hand temperatures should go up during recovery and down during stress. It may be going the other way. There's all sorts of things that we can tell just looking at this. And again, it's one more checkpoint to be able to see whether that nervous system is functioning ideally or not. SEMG, the traps, and the facial muscles are the ones that we focus on. And the reason we focus on those two is because they're cranial nerve supplies. They're not like any other muscle in the body. They got direct connections with the brain. Not secondary, it's direct. And it's there because it's done for the fight-flight mechanism. It's to hold the neck rigid in case of stress so you don't get a broken neck, or to lock the jaw so you don't get a broken jaw when you're going into a battle. The brain knows that those are important. So we need to be able to see how your stressors are affecting those stress response muscles. You know, we have people coming in with acute low back spasms and low back pain. You know what? That is just a protection mechanism. That's an SEMG response that we can see, those tight muscles in that lower back and the spasm. That's how stress is affecting these people. That's their neurological pattern. It doesn't just happen because it happens. It happens because the nervous system says, I have a problem, I'm going to lock that area up. It's a neurological problem, not a physical problem. It gets elevated during baseline. If the muscles get tight during just sitting there and relaxing, they have high anxiety. If it's elevated during stress, the high muscle tone response, it tightens up. It shouldn't go too far. There's a normal limit to how tight those muscles should go. It should relax when the stress is removed. The shoulders should not go up during the breathing exercise. If you do that, then you're an upper respiratory breather. See, this is all the stuff you need to see that you don't see in a static paraspinal. This is incredible information to know about your patient to find out what's really going on and what's happening with them. Skin conductivity, moisture in the hands, when above 1.5, it's an acute sympathetic response. It's a threat response. That nervous system is on guard. If it's below 0.4 and flatline, that suggests a chronic state. That's a state of neurological exhaustion where that nervous system has literally shut down that particular response because it needs the energy elsewhere. We can see how much danger our patients are in or how long this problem's been going on. Respiration, it's above ideal. It's sympathetic overload. It can be chaotic. That's an exhausted nervous system where they're breathing faster when they're supposed to be relaxing than when they're under stress. If they, during a part of this testing as a math test, if they drop or hold their breath during cognitive challenges, That means like if they were being challenged by a lion that was going to eat them, they'd hold their breath. Well, try to run away from a lion with holding your breath. You're going to go about 10 steps and run out of oxygen, and the lion wins. So we have to know how these people are reacting. Poor recovery. We want to see if their nervous system breathing area can return to an ideal state after a stressor and see whether it's in balance. Heart rate variability. We've all heard about heart rate variability. It's out there. It's been out there for a while. It's a measurement of the ability of the effects of the sympathetic and the parasympathetic nervous system on the heart rate during inhalation and exhalation. Your heart rate should speed up on inhalation because that's sympathetically driven, and it should slow down when you breathe out. That's why we want you breathing out longer than breathing in, so you stay in parasympathetic mode and calm things down. Heart rate variability is a strong indicator of not only health of the heart, but also in the effects of stress on the neurological patterns of the body. It gives us another viewpoint of what's going on with the heart. We also know there's been research done out there that shows that the heart rate variability patterns are a good form of measurement for the effectiveness of chiropractic care. I want to say this about heart rate variability. You can do heart rate variability, but you need to look at heart rate, you need to look at respiration rate, and you need to look at how they're breathing with their shoulders with the traps to get a clear picture of heart rate variability. Just doing heart rate variability and trying to get them in compliance isn't all the answer. There's much more to this, and you have to measure all three of them, or all four of them, I should say, to be able to get a real clear picture of what's going on. Otherwise, you're playing with a toy. Even the person that owns HeartMath took a look at our pattern and what we do with the NeuroInfiniti and said, HeartMath is a toy compared to what we've got. That's from the owner of HeartMath. Cortical patterns represent the hardwiring of the brain as set by experience and repetition. The brainwave frequency creates a state of being and directs the limbic system to respond to that state. Ideals of both ratio and frequencies and the brain's ability to engage and disengage these frequencies are a critical factor in the health of the individual. So what are we talking about? This is the new part for most chiropractors. And we know this. There are different brain activity frequencies. So if you're in alpha, everybody heard about alpha pretty well. Alpha is a conscious, relaxed, meditative state. Healing starts in alpha. Healing happens in alpha, theta, and delta. Theta is light sleep, it's subconscious. Delta is deep sleep, it's also deep subconscious. And then we have beta, and beta is the wide awake alert defense mechanism. It's a flight state. Healing is not available in beta. As a matter of fact, pain lives in beta. If you're truly relaxed and in an alpha state or a theta state or a delta state, pain does not exist. So when people are coming in to see you and they've got pain, you know that already their cortex is in an over-aroused state. And we can measure and find out exactly what this means. So we can measure these cortical patterns and find out what kind of shape they're in, whether they have PTSD or ADD or ADHD. We can tell all these things from these various patterns that we see. And this is what we will walk you through and teach you how to read this. And it doesn't take rocket science. We have ideals to show you what it's like. We explain what happens with this, and it makes sense to it. If people are in too much theta, guess what? They're under-aroused. So all this information is very important when it comes down to our care guidelines. We've dealt with frequency, we've dealt with duration, but now we have to deal with the intensity of our care to make sure it matches the needs of the patient. So frequency is recurrence of care times, minutes, hours, days, weeks, months. Duration is length of care, how long that's going to go on. And you really can't change the frequency of the care over the duration without having some reason for changing the frequency. So that's where the old Parker method fell apart. We went 3 times a week for 2 weeks down to twice a week for 2 weeks just because we set the pattern, not because that met the patient's needs. It met our needs for setting up some sort of a goal within our office, but it didn't align with the patient's needs. It has to align with the patient's needs. The next thing we looked at, and something we'd never ever considered, is what type of technique or amount of areas involved and what kind of frequency, because that's going to also play a game within the intensity of the care. Now, you can use the techniques you're using now. You don't have to learn a new technique unless you're stuck with one technique, and I would recommend highly that you have at least 3 techniques in your bag that allows you to administer different type of approaches for different needs. So this is all based on a law of hormesis. And the law of hormesis is a biological law that's in place today. It's been tested. It stands the test of time. It says this: strong stimulation stops a physiological response. So the higher the force, the higher the stimulation. Manual adjusting can be very, very dynamic and very forceful. It can also be done very lightly. If you're doing multiple areas, that's more stimulation. If you are doing the Magic 7, that's a massive amount of input. If you're trying to crunch everything you possibly can, that nervous system is being bombarded with input, and it may be more than that patient can handle. The frequency of the care, so if you're seeing somebody every day of the week versus twice a week, there's a different amount of stimulation involved with that. So that's why it needs to be considered under strong stimulation. Upper cervical work, very high stimulation. TMJ, very high stimulation. One of the techniques that I love so much is KST, because you can vary it along the way. You can vary that amount of input with KST. Next one is moderate stimulation inhibits a physiological response. Wait a minute. Strong stimulation stops a physiological response. So if you're doing a massive adjustment every time they come in, that nervous system is trying to get itself back into balance, but your massive input stops it and has to start over again. Stops it and has to start over again. Stops it and has to start over again. Where if you started to back off, once you saw the nervous system starting to make some changes, you saw the person was improving, and you adjusted your stimulation to match the needs of the patient, and it's just going to inhibit. It's not going to stop it. It's just going to put that, wait a minute, slow down attitude. You don't have to stop, just slow down a little bit. And that's instrument adjusting or lighter manual adjusting, TRT, activator, you name it. KST frequency can go down a bit during that time period to get moderate stimulation. And the last one is light stimulation encourages physiological responses. I don't know about you, but I always wondered how these light touch techniques worked, how they got results when I was taught I had to move a bone. And yet there it was. People using the instrument adjusting were getting great results. People doing light touch like Network or Best or Access or KST like with light frequency were getting great results as well. That's because that nervous system had reached that level where all it took was a nudge, and that nudge said, great, I like that. It encourages me to keep moving in the right direction. We never knew this before. We never applied this to chiropractic, but when you think about it, it's why less and lighter is better as people improve. Intensity variables. As the patient's nervous system responds and moves towards balance, less stimulation is required, and therefore frequency, duration, and intensity must be altered to match the neurological needs. But you have to be doing some measurements. You have to have some sort of objective outcome studies to be able to show this. So the concepts are this. If it's an over-aroused nervous system, you don't want to be putting in a lot of stimulation. You want light stimulation, less frequent, fewer areas, but a longer duration. That's the key there, folks, longer duration. So care, instead of being 3 times a week for 6 weeks, it may be twice a week for 12 or 14 weeks. And here's one of the things that's a rule that we've learned in chiropractic. The people that stay under chiropractic care over longer duration get better results, especially in areas that they didn't even know they were having problems with. It's all about getting people to experience chiropractic over a longer duration. It works better. Under aroused, stronger stimulation, more frequent, more areas of moderate duration. In stable, then you have to vary between the over-aroused and the under-aroused depending on the state of the patient's nervous system at the time they came in. So if they were wide awake and bushy-tailed and bright-eyed and raring to go, you want to slow them down a little bit. But if they can hardly get out of bed and their nervous system is now stuck in the under-aroused, you would want to do a more stronger stimulation more frequently and more areas. So you have to ask those people. When you see them checking off that on that biochart, you need to have a note on your case history that says, hey, I got to check this person every time they come in and find out what kind of an adjustment they need, an up adjustment or a down adjustment. The exhausted, very light stimulation. Remember, these are people that are now in autoimmune system disorder states, much less frequency, but a very long duration. So like once a week for 6 months or a year. Oh my God, I have to book a patient for a year. I don't think I can do that. That's what these people need. These people, when you see these people, man, you tell them that they're in serious trouble. If you're in a state of autoimmune system disorder, you're in a life-threatening state. And it's going to take us some time to get this nervous system of yours back into balance. We can't do much because if we do too much, you're going to have problems. And they know that already because if they clean the house, they're going to collapse. So less frequency, once a week, 6 months anyway. And you really have to be careful you don't overstimulate them at all. Post-traumatic stress is an acute state where the nervous system is in mental breakdown. It is absolutely the worst that you can find. These people are having a complete neurological breakdown, and they may not make it out if you don't get them stabilized. What we found out is ADD is a chronic state, and it's a stability state coming back out of post-traumatic stress. Those that make it out, that don't have the burnouts and end up talking to voices, those are psychotic, and those are the people that are at post-traumatic stress disorder levels. Once you start taking care of these people, you'll probably see an ADD response showing up, and we can show you what that looks like, and that's a good sign that says that it's starting to stabilize and the nervous system is protecting itself. Neurofeedback training is a necessity after chiropractic care to obtain the best results. What people don't understand about the chiropractic adjustment is that it's a neurological pattern interrupt. It interrupts the pattern, and it's a feedback system so that every time you interrupt the pattern, it resets itself to a little better pattern. But if they go back into their life of stress, it'll go back into that defensive pattern that it's been in. We need to have something else going on with these people to help them to retrain that nervous system to better patterns. So priority of neurological dysfunction, if you look at the limbic system and they have one area of challenge, their heart rate's too high, everything else is okay, that's a stage 1. If they have cold hands and bad heart rate, that's a stage 2. If they have cold hands, skin conductance and heart rate's not right, that's stage 3. So every one of these, you just add a stage to every level of dysfunction. If they're on meds, I count meds as 2 stages. High blood pressure would be a stage as well. So we look at that and we can determine how bad that nervous system is from a limbic system level by how many areas are not operating within the ideal ranges. The cortical activity, slight dysfunction, poor engagement, it doesn't engage the way it should when you stress them, or doesn't disengage, that's a problem. So that shows another area. If their stress response or recovery challenge, if what we see is that they're not adapting correctly to stressors, or they're not recovering, or the pattern is now out of balance completely, where there are way too much beta and not enough alpha theta, those are serious challenges. That tells us that that hardwired brain pattern is driving the limbic system all the time. And until we change that hardwired pattern, that system is going to come back into imbalance. Moderate would be ADD or ADHD. Severe and chaotic would be post-traumatic stress, is what we're looking at the cortical levels. So now we've got a whole bunch of direct central nervous system information to be able to determine what kind of care these people should have. If they have ideal responses, great. But if they have slight dysfunction on a short duration of this challenge, that gives us some information as to how quickly they should respond. If they have abnormal neurological patterns, and a whole bunch of them, it's been going on for a long time, obviously it's going to be harder and harder to change. So that means the care pattern is going to be longer. The number of autonomic abnormalities show the level of neurological challenge. If they have all 6 of these things that aren't working right, plus cortical patterns, we got some severe problems, and it's going to take a while to get things changed. So the number of stages will determine the frequency, duration, and intensity of the care. Non-responding challenges, here's what's going to happen. You get people going along and they get fixed in one area and they can't seem to get through that. We need to focus on that area and find out what's the key to getting that area unlocked within the central nervous system. So here's an example. Here's a 24-year-old, abnormal EEG. This person is an ADD individual. That's a protective measurement of the brain that says that they've been under stress for long enough that the brain says, I can't handle stress. So every time we stress them, that brain shuts down. But every time they try to relax, now it goes into gear. That's not a good way to be. It means that also that their sleep patterns aren't good. So they have 4 areas of irregularity. The duration of the problem is 5 years. It's recurrent. So that means they're a stage 5. They have abnormal EEG and 4 areas, stage 5. So here's what we're going to look at in initial stabilization care. I'm going to see these people 2 times a week for 14 weeks. Intensity, I'm going to be light intensity with no more than 3 areas, dropping to fewer areas of adjusting and lighter techniques as this patient starts to show signs of stabilization, and we work towards building new neurological patterns or returning them to a better balance. Okay. Biofeedback application, I would start the biofeedback working with the limbic system. I'd start training them and say their skin conductance and their hand temperatures or their breathing wasn't good. I'd put them on the unit after the adjustment. Nothing's more important than the chiropractic adjustment. You interrupt the pattern and then you put them onto a training program and you start to teach them how to get their nervous system back into balance. Biofeedback training should follow each adjustment, not before, after the adjustment, after we've interrupted the pattern. Once the patient shows the ability to master biofeedback, then you can move to neurofeedback during this time period. So probably at areas at around the 5th or 6th visit, I would be starting then to move them onto a neurofeedback training and see what we can do to get those hardwired patterns changed. Bio, neuro, and dynamic SEMG retraining can be done more frequently than just the adjusting profile. If you're seeing them twice a week, you could have them coming in the meantime to be doing more training with the biofeedback or the neurofeedback. Remember, every time you do that, there's a charge for it. It's an income center. So is this a cost or expense? Well, if your practice is stalled or is falling, it's because the message that you're putting out in your practice as to what you have of value is not working with the patient. You need to create something of greater value. Your practice needs to adapt to new information, and there's a ton of it out there that is just mind-blowing. You need to broaden your scope of practice. If you're stuck in taking care of back pain and neck pain, you're selling yourself short. You're selling chiropractic short, and you're selling your income extremely short. You're creating all sorts of frustrations and challenges for your lifestyle, your income, and what you can offer your patients. We are way bigger than back pain as a health practitioner. You need to you need to make an investment in your practice. You can't just expect this stuff to come out of the blue and walk into your office. You have to pay attention to what's going on out there. And most of us don't do this. You need to be putting an investment into your practice every year. That means you need to pump dollars and cents back into your practice, whether through its new courses that you take, or new instrumentations you take, or new procedures you take, whatever it may be, new equipment in your office, but you need to continually to invest in your practice. It's your life source. It's what generates what keeps you going. So you have choices. And this is the nice thing about it. You get to make these choices. You can stay doing what you're doing. You can still order, the hamburger and the milkshake at the library if you want to. But I guarantee you're going to get exactly what you're getting right now. You can get access to the new information that can change your practice. We have NBC calls that are available once a month. They're not expensive. You can get on, you can sign up with Dee, and you can get on, and every month I will send you information on chiropractic and the nervous system that you can hand out to your patients. You can just literally take what we send you and hand it out. And what we do is a 1-hour recorded call on this. So we have specialists that come on with me, and we talk about this research data so you can listen to it so that you can get your dialogue right when you hand it out to patients and be talking to them. That's available in the NBC calls. You can escape from the pain relief, back pain foundation of your practice. Change your concept of who you do. Change the value of your practice. You can make an investment in your practice, and you can purchase a NeuroInfiniti. And there is nothing out there that competes with this. There is no instrument out there that does what this does. There's other instruments out there that do neurofeedback, but nobody does the scan first. And when you talk to people that are experts in this field, unless you do a scan and know how to approach this, you're just punching in the dark. And punching in the dark when you're working with people's brains is not a good idea. So that's why we do the NeuroInfiniti stress response evaluation. We do a scan first. Well, let me show you what happens with this. People think this is an expensive piece of equipment. It isn't. It pays for itself very quickly. You do a neurological exam, NeuroInfiniti exam, and you charge $195 for the exam. That's your initial examination. Any follow-up exams can be $75. These are just arbitrary numbers, but they're numbers sort of within the range of what we find works out there. But here's what happens. If you do 2 exams a month, that's $390 income. Plus, if you do 2 follow-up a month at $75, that's another $150. So now you're generating $550 per month. Your lease payment on this equipment is less than $400 a month. So to me, I don't know about how you do math, but if I'm generating $550 and spending less than $400, I don't see it as a cost. I see it as an income. And that's the way this works. You put this to work, and we can put you on to doctors that have put this into their practice, and this is what they experience. You add the income from bio and neurofeedback retraining, and it establishes that the NeuroInfiniti is truly an investment, not a cost. An example that I used back there with that patient I said before, that 24-year-old, this is what it'd be like at $50 an adjustment. I don't know what you're getting for your adjustment. I just took $50. That case value is now $1,870. $1,870 on one. So you double that one out, and now you're talking about, what, $3,740 for 2 patients in 1 month, where your cost on the lease payment is less than $400. This is a no-brainer. This puts the excitement back into your practice. The key to the success of all of this is you have to implement. You've got to make the move. You've got to change your message. You've got to change your mindset. You've got to change your dialogue. We provide all of that. It's so simple because in your heart, it's what you've been doing from the very first. You believe that the nervous system is the primary focus. Nobody ever gave you the tools to be able to measure it. We can now supply the tools, and you can become congruent in your practice, in your belief system, and we can explode this profession and get it back to where it belongs. That's what we're trying to do here. So get on board, join the program, get this thing in your office. Let's get working with it. My goal with this is to change the direction of chiropractic, because if we don't, we're dead. We're going to be no more than physical therapists. Get on board with us. Come and play. Thank you.